Kathleen Cramer, Manatee County resident. I heard a lot of talk about mental health, about drug problems, about bringing more homeless to our community with our outstanding services. So I wanted to just kind of end with some statistics for you. First of all, chronically homeless are less than 15% of all homelessness. Please keep that in mind when we're making policy, when we're talking about homelessness. The folks you see on the street, 15% of individuals who are experiencing homelessness. So we heard that homelessness is primarily a mental health problem, but decades of research shows that less than 1/3 of people experiencing homelessness have severe mental health illness, but 100% of them don't have housing. If mental health was the main driver of homelessness, places with the most mental health issues would have the most homeless. But data shows the exact opposite. Mississippi has the worst healthcare system in the United States and the lowest homelessness rate. We also heard about drug problems, but statistics show that only 20 to 40% of homeless persons suffer from drug abuse. If drug abuse was the main driver of homelessness, it would be reasonable to expect that the states that have the most drug use would have the most homeless, but statistics again do not support this. West Virginia has the single worst overdose rate in the country, but one of the lowest homelessness rates in the country. And only 1/3 of those with addiction actually had that problem before they became homeless. 2/3 started that addiction while in homelessness. We talked about homelessness being a progressive policy issue, but if this was the case, wouldn't the most generous welfare benefit states have the most homelessness? Data doesn't show that link at all. Or wouldn't progressive cities with similarly high levels of homelessness have have similar levels of homelessness throughout? But they don't. Blue cities like Detroit and St. Louis have much lower rates of homelessness than New York and San Francisco. Why? Housing costs. Places with the highest housing costs and the least housing supply have the largest homeless population. If the primary problem of homelessness is housing, then the primary solution is housing. Atlanta reduced homelessness by 40% through housing. Houston reduced homelessness 63% through housing. Housing is vital, but it will never be enough on its own. For the disabled, elderly, and other vulnerable populations, we will need supportive services. But data clearly shows that the places with the best track records of reducing homelessness do two things. They build ample affordable housing, preventing homelessness in the first place, and they have ample subsidized housing to humanely and effectively address the homelessness that does occur. Places with the highest addiction rates, severe mental health, highest poverty rates, most generous welfare benefits do not have the most homeless. Places with the highest living costs do.
Thank you, ma'am.